Morning, everyone. Thank you for coming to our workshop. I'm Megan Evans. I'm here with Dr. Preetha Nandi, who's one of our PGY3 residents at Tufts Medical Center, who is also the author of our residency curriculum, which she's going to go over in a little bit. But we wanted to give you some tangible tools with specific advocacy efforts, and we're going to go through each one. At the beginning, we have a poll that Dr. Nandi is going to run. And Preetha, if you want to go to the next couple slides.
Sure.
Great. So I'm Megan Evans. I am an OB-GYN at Tufts Medical Center. I have a strong interest in advocacy and health policy. And I'm sure if you just came from the main session, you know all about that. And I have long been interested in how policy impacts how our patients access care and how we practice medicine. There are a lot of different ways that we can be strong advocates, and we wanted to really break it down for you today. So, and I want Dr. Nandi to introduce herself as well.
Hi, everybody. I'm Preetha Nandi. As Dr. Evans said, I'm a third-year OB-GYN resident at Tufts Medical Center. I'm originally from the Southeast and I'm now up here in Boston, learning to be an OB-GYN. And so I also share Dr. Evans' passion for, reproductive justice and advocacy work, especially in health equity issues in the United States. And I think, what we'll get into as well in this workshop is how to, especially for educators like yourselves, what are tangible ways to incorporate these kinds of advocacy tools into curricular development too.
Great. So these are our objectives today. And Dr. Nandi and I are going to go back and forth with 4 different topics and worksheets that I've included in the link, and I'll repost it in for those of you who've joined afterwards. I'm going to try to include just the PDFs as well, so you can open that up and follow along with us. And we hope that this toolkit you'll be able to take with you and continue to use, add to it if you want to continue your advocacy efforts. On the bottom here is this poll everywhere that we're going to incorporate. So these are ways that you can either go directly to the website or you can text Preetha Nandi 298 to 22333 to involve yourself in our poll. So we'll give you a second to get there while we head to the next slide. And I should say this is designed to be interactive. Obviously, when we were going to meet in person, we were going to have different tables and walk around and be really interactive. So we encourage you to pause, ask questions. If anything comes up that you're not sure about, that you want to talk more about, that's the goal of this, is to give you those tools before you leave this workshop. Oh, perfect. And so the outline, what we're going to do is we're going to start with the first tool is helping with your with written advocacy. So that's op-eds, letter to the editors. Oftentimes some things people can find very intimidating, but we have really incredible resources for you to take a look at, and we're going to break it down how to get this message across in an efficient, timely manner, because we all know you're very busy. Second, we're going to talk about social media. I know I touched a little bit on that in the last talk, but really breaking down what that means and how to craft a tweet or an Instagram post. Next, we're going to talk about testimony and storytelling, an incredible way to advocate for patients, especially telling patient stories. And then lastly, we're going to talk about advocacy curriculum that I think many people are interested in, but are not quite sure where to start.
Great. And I will also just add for the poll everywhere, sometimes there is a limit to the participant or the number of responses. So if you run into that issue, which hopefully we won't, but if you do, then you can feel free to just unmute and say it aloud, or add your comments in the chat. This is meant to be very informal, so however you'd like to participate. So if everyone is has been able to log into the poll everywhere, and I think it'll pop up on our next slide as well for people who are still joining. I'll go ahead and advance. So as Dr. Evans mentioned, we will be doing 4 mini workshops within this hour. And so we'll start with a couple of questions that will sort of probe into those 4 different categories. So this first question is, what is your experience in op-ed, writing op-ed pieces? And oftentimes with these workshops, we'll have people with sort of a varied experience of having not writing any op-ed experience, which is great and a good place to start. Or if you've written something or jotted notes down somewhere, or but haven't figured out how to get it out there yet, or if you have published. So, and I'm hoping that the poll, it looks like the poll is working for folks. Let me give folks just one more minute to sign in. Great. Okay, so we will definitely be going over some of the very basics of some of the types of written advocacy and really try to break it down in a very simple way to make it less intimidating and less complex, and really it'll be pretty straightforward. So we'll move on to our next question. Let's see. I think. Okay, here we go. So this is just a question to ask, where do folks read their op-ed pieces? It can be a varied number of places. Sometimes it just takes a minute to upload as well. Okay, so New York Times, Washington Post. A lot of New York Times readers. Twitter links, okay. Yeah, everyone is super busy and it can be really, and maybe, you don't read that many, that's totally fine. Great, so we'll talk a little bit more as well of sort of thinking outside of the box of where to submit opinion pieces. And also something to bear in mind that we didn't include in these questions is, where do you think your patients are reading these pieces as well? So something to keep in mind. Move to our next one. This is a new type of question that we're kind of trying out. I'm not sure if folks will be able to do this on their phone or not, but which social media platforms do you personally participate in? Great, so we have Facebook, Instagram, Snapchat, great. Twitter, some LinkedIn. TikTok, again, I encourage folks to think about, where their patients are also participating in these social media platforms. So I think all of that is quite relevant. Great, so definitely a mix. I think there's still a lot of popularity within Instagram and Facebook and Twitter. So we'll also, Dr. Evans will be discussing more about this and her part of the workshops about how to really engage with patients and providers alike in advocacy work through social media. Oops. All right. And then again, kind of getting at this crux of this question is what have your patients told you during your clinic visits in the hospital and clinical scenarios of where they are getting clinical or health related information? Great. So Facebook, Twitter, Instagram, a lot of these um, popping up again, lots of videos on all of these, platforms. Perfect. All right, great. So we'll move on to our next question. So then we're going to move on to another part of our talk is again going to be breaking down how to approach providing either written or oral testimony. So we were curious as to what types of testimony, if any, folks have participated in this group. Abortion access, okay. Yeah, I think, over the past, many years, but especially over the past 5-6 years, there's been many state level as well as federal level abortion access issues, and they having a physician voice there to give testimony makes a big impact. Contraception access, absolutely. Mental health, absolutely. It's really great. Perfect. I was wondering if someone would bring up maternal morbidity and mortality review committees. That's awesome. Great. All right. Excellent. Well, again, we'll kind of go over, how to sort of organize and get involved in testimony, and again, sort of break it down in a simple way. And then these last two questions are related to sort of the curricular development as well. So we were curious, I know it came up a lot for our applicant cycle. So during this past current resident application cycle, how often was advocacy asked about by applicants? Great, so certainly a mix. I think that participation in advocacy, whether it's at a medical school level or residency level, or even at the junior faculty level, is something that is becoming very popular, and people are recognizing the need for structured opportunities for this. So we'll talk more about different ways to incorporate this in your program. All right, so I think that's I'm going to stop sharing here. That's the end of our sort of polls here. And again, please feel free to interrupt us at any time with any questions or comments. I'm going to go ahead and share our first mini workshop activity, which is a worksheet on written tools for written advocacy. And I believe Dr. Evans has also dropped each of these PDFs in our chat function as well. So we'll start with the first one, the APGO op-eds PDF. Let me share it here. All right, so our goal with this workshop is to talk through these 4 advocacy tools that you can incorporate in your own practice, in your colleagues' practice, in teaching medical and students and residents. And what we'll do is we wanted to break away a little bit from the traditional PowerPoint model. We will start with kind of going through these worksheets, which are meant for you to, mark on, take notes on, and we'll spend about 7 to 8 minutes on each of these things. And we have an exercise at the end of each of these worksheets that we'll briefly go over. We'll stop at the end of each of these mini workshops to ask for any questions or comments. And then at the end of these 4 mini workshops, we'll spend some time on whichever exercises you feel like you want to work on. So to start, for op-eds and letters to the editor and any of these kinds of opinion pieces, I think this is sort of one of the more traditional ways that folks in the medical community have participated in advocacy. And so just sort of as a background, op-ed or opinion editorials sort of got their namesake from being the opposite in newspapers to an editorial piece. Now op-eds are primarily used to represent sort of a strong, impactful, informed, focused opinion on a particular issue of interest. And I think as you've mentioned in the polls, we've seen op-eds in various kinds of platforms, whether it be some of the bigger newspapers like New York Times, Washington Post, Wall Street Journal, to also local papers. But there's a lot of new and different spaces that opinion pieces are read and can be shared with the public. So some of these may involve columns, like sometimes you may see different advocacy columns in the different sort of OB-GYN publications that you read, such as OB-G Management or Contemporary OB-GYN. There are editorial pieces in many of these news outlets, as well as other sort of places that you may read, which are typically written by an editorial board. So some of you may participate in some of the editorial boards of other journals or other, again, OB-GYN or reproductive health related publications. And so this is definitely a way to use your voice as well. Letters to the editor are typically written in response to an existing piece. You've likely seen this in some of the medical journals. It'll be about 200 to 250 words. And again, responding directly to a piece that's already written. And then there's also these sort of various publications will have different names for these other opinion pieces called either perspective or viewpoints, or, you know, from a physician's point of view, that kind of thing. And some of these pieces can be more on the side of like an op-ed, where you're just more traditionally sort of arguing an argument or sharing a persuasive argument about something. Or it might be more about sharing a patient perspective or a provider perspective. I think a lot of these have come to light in amidst the COVID pandemic, and we're seeing a lot of, you know, providers sharing these experiences. So that's another place that you can look for in various, you know, outlets of how to produce a written piece. To the right here, I'm just going to share that, you know, there's a lot of different places to look for inspiration for these opinion pieces, right in your clinic, in the OR, in you know, in the hospital setting. Maybe your inspiration is from, you know, headlines that are going into your Twitter feed and making you riled up about something. Maybe it is from your local news or from a parent blog or something you were emailed about through another interest group you're involved in. I added this notation of the sticky notes on the side as well, because one thing I'm hoping folks can get out of this workshop is, you know, we recognize that your time has many demands, both clinical and otherwise. So, you know, asking folks to just sit down and write an op-ed when you have time is a very hard thing to do. However, we also know that you get very fired up and passionate about these issues that are directly impacting the patients you are taking care of. And so, you know, kind of saving things for later or like starting to draft out these ideas or thoughts when they are happening and putting them somewhere that you can refer to when you do have that potential time to really flesh it out and publish it, is something that I'd really encourage you to do. I have on my notes app on my phone, I have sort of just like general musings kind of notation. And so I'll take notes if I'm like waiting for a patient to be extubated and going to our next case, or if we're waiting in between cases, or just again, amidst your busy schedule, if something comes up about a patient encounter or something you read online and you want to refer to back to it, just somewhere that you can take those notes down. I'll also encourage you that, with these topics in reproductive health, one of, this is not new news that people in the public are very passionate about issues that impact women's health. And you as a physician have a very critical viewpoint and a very valuable perspective to share, both from your expertise as well as these coveted and very intimate encounters you have with patients that really share the story. And so the other thing I would encourage you is that if you have, a moment to kind of write these things down, these issues, even if it's happening now, it will likely happen again, in the future. So yes, like there's a lot of issues related to like vaccine access, abortion access, maternal mortality now, and the conversation is going to continue. And in this fast-paced news cycle, if you don't have time to publish it in the next 1 to 2 weeks, the issue is going to come up again. And having something sort of 75% done and ready is much easier to kind of get that out there when that issue comes up again, as opposed to starting from scratch. So again, just, I'd encourage you to sort of take these notes somewhere that you can refer back to when you can find the time to participate in this type of advocacy. So next we'll kind of move on to the anatomy of an opinion piece or anatomy of an op-ed. I want to share a huge thank you to my colleague, Dr. Akshaya Kannan, who's over at UCSF, and as well as many resources that are provided by the Harvard Kennedy School. There are many resources that exist out there that have this sort of basic outline of how to write an op-ed, but I kind of liked this very discrete, ABCD way of organizing an op-ed, and this will come up in our exercise as well. So, most critically, and I think maybe the most challenging part about an op-ed is this hook, setup, and thesis statement. So really, you want to start your op-ed or your opinion piece or perspective piece or whatever you're writing with 1 to 2 sentences that will really grab your reader and pull them in. Really getting people past that first 1 to 2 sentences is tricky, but also so critical to getting them to read the rest of your piece. As you know, like time is limited, so really trying to draw them in is very critical. And then developing this thesis statement or the main argument of your piece is also really important. I'd encourage to sort of like draft and redraft this one statement and kind of start here and then move on to your next pieces and then readdress it and see if you need to edit it in some way to incorporate what is your main argument for your piece. And then you can move on to this sort of diagnosis. So this is the analysis of your problem. This is where you can start to incorporate basically your points that are going to help support your thesis. These things may include some data points. They may include some research that or evidence that supports your statement. But I think especially coming from a physician standpoint, and we'll get into this more as well, this is also where you will be incorporating your patient stories or physician experiences. That is so much more captivating to, I think, both clinicians, patients, and the general public alike. And so those stories are really going to be what's going to support your thesis statement. You can then move on to your prescription and concession. So your prescription is, again, sort of after you've sort of laid out your evidence, either through data or through your stories. What are you proposing? What is the issue that what is the next step forward? And then the concession piece is also very critical. This really addresses the 1 to 2 components from an opposing point of view, and why people should really, listen to what you are saying, or why is that argument not in line with what you think is more correct. One of the resources I like referencing for this kind of work too is the Op-Ed project, which, by the way, has a great website with lots of resources, but also has workshops, virtual and in person, that are also very helpful. And this is sort of that they refer to this portion as the to be sure paragraph, really cinching home why your argument is the most persuasive. And then you always want to end an op-ed or opinion piece with some kind of call to action. And again, whether that's in a medical journal and you're asking fellow clinicians what to do next in their clinical setting, in their institutions, in their state and maybe even federal legislative levels, or whether it's a call to action for patients or the public or your lawmakers. It's really important to make this call to action tangible, as well as feasible, just so that people can really grasp onto that. So here in the bottom right corner, I'm just going to take a quick look at time. All right, I'm going to kind of breeze through this a little bit. This is an example of, again, an op-ed about employer-sponsored health insurance, and how it plays a role in structural racism. I won't read it out loud here, but you can see how this powerful statement sort of brings the reader in, and then has a very pithy and to the point thesis statement that the rest of the op-ed flows from and supports. To the left here, these are just some bullet points for other considerations to when you are writing your opinion pieces. I think it is very common for us, especially when we're trying to prepare manuscripts and things like that, to write these very complex sentences and thoughts that fully encapsulate an idea. And I would encourage you to try to use short statements when you're writing your op-eds, because that's how people are going to just quickly breeze through your piece. Again, similarly, we are very, it is very easy for us to use passive voice, just like I just did now. So I would say, trying to avoid the passive voice when you're writing as well, and sometimes reading it out loud to yourself in that way to try to, it's really, again, something that will engage your reader and make it just easy to read. Focusing on stories and only including the most pertinent facts or data points. Statistics and p-values are very important in medical writing, but this is a different type of writing, and something that's going to convince you and other clinicians, and again the general public, is going to be more based on these stories and these things that people can really relate to, as opposed to numbers. Definitely consider your audience and intended publication. We'll go over this a little more in the next page of the worksheet. And then I would also suggest, avoiding using quotes, cliches. Really try to, there's a lot of those kinds of statements that are very easy to pull into op-eds because we think it's what we want to hear, but it just falls a little bit flat. So I just encourage to try to avoid those things. And then editing is important, reading it out aloud, sharing it with someone that's outside of the medical community or outside of the OB/GYN sphere is important, but also then getting it to a point and then submitting it, because it's not going to be read unless it's submitted somewhere. So, kind of taking that leap of faith in yourself and in your piece that you've worked so hard on, and getting there is important too. Here at the bottom of the first page, I also just note, just remember that for messaging, especially about charged women's health or, birthing parents' health issues, it's important to know that these issues do have sort of stir strong opinions out there, and you don't want to alienate your readers right off the get-go. And that applies in a lot of different types of advocacy. So it's about making your op-ed persuasive, but also palatable. And this depends a little bit on who your audience is. And it's not to say that you need to tone down whatever your argument is, but writing about it in a way that is acceptable to readers is also important to make sure you kind of captivate that audience as well. And there's different kinds of like messaging advice and messaging boards and things like that that are available out there as well. So then this next page goes to, you know, once you've drafted that op-ed, now what to do next? And all to say is I'll just briefly say that this is something where thinking outside the box of where you can submit these pieces is really important. You know, it is really difficult to try to have an in for the Washington Post, New York Times. But if you publish, as Dr. Evans mentioned in her plenary speech, that, you know, if you publish in a local place that your, you know, local community is actually going to read, that's going to have a really huge impact. So I think I would encourage you to break it down to really think about who you are trying to reach with your piece, whether that is your local community, your patient population, other providers, and then think about where are they getting their information and what is truly feasible for submitting. For example, in your local community, there are hometown or local papers. There's often many local magazines or health related blogs that are shared. Maybe the local publication of your academic institution, the student newspaper there is a good place to start, especially if you're a medical student or another, you know, in the academic sphere. And then lastly, I will also say is just as far as where to sort of target your piece. The beauty of social media and online publications now is really like where you publish is less important now, as long as you can like share that message. So if it's published somewhere, you can really share it through your social media networks, through the social media networks of your associated organizations like ACOG, APGO, CREOG, wherever you're affiliated with. That has a lot of power to get your message across. That said, sometimes people will go sort of the opposite direction and want to just write something and publish it on like a free place like Medium. And I'd just advise a word of caution for that, because you have spent a lot of time and effort into creating this wonderful piece, and it deserves to be read and shared with the right audiences. So if you do have a really large readership through either your social media platforms and you feel like the only place you can post is somewhere like medium.com, that's fine. But I would say, you know, really get yourself out there and think of these other out of the box places of where to publish in order to get your message across. And then lastly, this is just an example of a pitch that you can take from here in your future written endeavors, and you can adapt it. And typically you will need to pitch your article or your op-ed to either the news outlet, your local paper, or again, if you're using an online blog, you'll just have to send an email with the attached article. So this is like an example of how you could pitch it. So I'll stop there. This is an example of the exercise that we will share towards the end. So this is, again, thinking about one of those topics that maybe you've thought about for a while and wanting to write something about, and how you could just write a quick bullet point or a phrase of how you would flesh out this idea. And again, you can save this for later if you find yourself very busy in this moment of time. And lastly, again, thinking about how, you know, thinking about those target publications in your community, in your sphere, and how you would go about submitting. So I'll pause there if there are any further questions for that.
Awesome, Dr. Nandy, thank you. It's such a big topic to try to break it down. So thank you so much for doing that. And I hope you all use this worksheet, and it's so concise and such a great way to jot down notes and think about, what message you want to send. I'll also say that I've worked with organizations who don't particularly want to be the author of a letter to the editor or a op-ed, but will help you write it. We all know we're really busy, so that's also a great way to efficiently and effectively get out a letter to the editor and op-ed quickly, and with support as well. Yeah.
Absolutely. Great. All right.
So we can move on. That one probably is our lengthiest because there's so much in it, but we'll do the social media one next. Great.
Can you see my screen, Dr. Evans?
Yes, I can.
Great, perfect.
Okay, so social media, and I know I talked about this at the other talk, but I can't emphasize enough, it's such an important platform to really amplify your message, and especially your advocacy efforts. We're going to talk about the anatomy of a Twitter account, of a Instagram account, but there's a lot of different other platforms that you can use. These are just the two examples that I think are most widely used. And I think what's nice about both of them, but specifically Twitter, is that you can connect and one issue through multiple different platforms using something like a hashtag. And that's where if you log onto Twitter, you'll see what's trending. And that's usually trending because of people tagging the same post. So, for example, APGO, CREOG, like hashtag APGO FDS, that might be something where everyone who tweets puts that in. And then there's a potential that it could get enough tweets and chatter that other people might pay attention to the other issues that are happening at this conference. So it unifies people around a common issue, for better, for worse. I know sometimes social media can go a little rogue on different issues, but certainly for our efforts, it has such a powerful potential. Like I said, there's a lot of different social media platforms. You went over those in the polls, but we're going to be talking specifically about Twitter and Instagram. So on the left is my Twitter profile. And just to go over, for those of you who don't have a Twitter profile, what the anatomy of a Twitter profile looks like. So you'll typically have your profile picture and what's called the banner photo. I've taken a picture from the CLC, which are facts are important. Women's health is no exception. I haven't changed it for years because it still rings true to me. So I've kept it on there. For me, I use this as my professional account. I do have an Instagram, but it's my private account. So Twitter is my advocacy go-to. I don't tweet about what I had for lunch. I don't tweet about where I'm going on vacation. I specifically use that for all of my advocacy efforts. And so I use my professional title there. And then my handle is my professional, Megan Evans, MD. So I am coming to Twitter as a physician. Your bio should be short and concise. So you can see here, I want to highlight things that I care about. And I'm using hashtags in there that will also connect other people. So if you were to click on the hashtag advocacy, you'll see every single time someone tweeted using that hashtag. And that's how we connect ourselves through different efforts or at different meetings, for example. I also do a little plug for our podcast, and then I use the link for people to go directly to that podcast if they want to listen to that. I do recommend for any sort of public social media account that you put in there that all views are your own. If you don't, and you're sending out messages, it could be misinterpreted that you're speaking on behalf of an organization that you work for or work with. So like my hospital or APGO. So that's, I think, a critical component to any social media platform. So you can see a little bit of my last tweet. And so this is where you can use hashtags, you can include pictures. So I have hashtag physician advocacy in there. You can tag people. So I could tag, for example, Dr. Nandi's Twitter account. And when I tag her, she would get an alert and she can retweet my message. So oftentimes when I'm sending out a Twitter or a tweet, I will include APGO Action because APGO Action has a much larger following than I have. But if I send a tweet, they see it, they can retweet it to their followers, further elevating that message. And so you can see below an example of a tweet that I sent specific to COVID-19. So hashtag pregnant women with hashtag COVID-19. So that connects every single post. So when COVID-19 is trending and people look at that, they'll see my tweet within those trending items. And again, this is something where it got likes and retweeted 11 times. So it's a retweeted. It doesn't sound like a lot, but every time that those individuals retweet that, that's going to all of their followers. So that message is being further elevated, and then their followers might retweet it. So that message just keeps going and going. And then I wanted to go to the Instagram page. So I actually reached out to this physician, Dr. Jennifer Lincoln, and asked her if it was okay if I used her as an example of a great social media platform. And she said, of course. So this is Dr. Lincoln. She's an OB-GYN out in Portland, Oregon. She is quite official. She has a blue check next to her name, which means she's a verified authentic account. She has 104,000 followers, and she's incredibly good at her social media presence. So again, she's using this in a professional setting. She has her name, her credentials, her job title. You can see her bio. She keeps it simple. She has on there, no medical advice here. And then what is a great way for Instagram, and for those of you who are on Instagram, is that there's different ways to get your message across. So you can see I have two arrows here pointing to her picture, as well as these what we call pin stories. So on Instagram, you can do a story that lasts for 24 hours. And that's when people have that orange, yellow ring around their name. You can click on that, you'll see a story. So she might be doing a live, doing a video chat about what's happening with maternal mortality in Oregon, but she can pin that story to save forever with these additional categories, and you can organize it. So if you wanted to you really cared about maternal mortality, or you really cared about doula services, and you have a whole bunch of posts on that, you can keep them all in that one post, one pin story in your Instagram account. So anyone who follows you can be like, oh, what's going on with doula services? And they can go and see all your prior posts there. And then her actual posts are something that will stay indefinitely. So that can include pictures. She does a lot of videos, texts on certain issues, and she has a really robust Instagram account. So these are some of the examples of her Instagram posts. She recently did a post about COVID boosters and pregnancy and postpartum. It's multi-picture post. You swipe through, but again, it got a lot of likes, a lot of people watching it and looking at it and making a big impact, talking about the safety of COVID boosters and pregnancy and postpartum. So Preeti, you can scroll down. So these are just some exercises that we wanted people to consider and that you can obviously do on your own time. But if you don't have a Twitter or an Instagram and you're ready to sign up, you can sign up with your handle and bio. What do you want to tweet about? What do you want to post about? Thinking about hashtags and how you're going to connect them to other posts. Do you want to tag anyone in your post and further elevate your message? What pictures do you want to use? And so here with Twitter, reminder that you can only use 280 characters. And so there is a limit. Some people will do a thread where they have multiple tweets, but I would say that your most impactful tweet is going to be that first one. What hashtags do you want to use? Do you want to include a picture? Do you want to tag people? And then Instagram, what picture do you want to put on there? And what text are you going to put below? So these are just ways to think about what you want to do for your social media presence. So I hope, again, you use these worksheets, you think about how you want to present yourself, and happy to take any questions, but we can certainly move on to our other topics as well. I know we only have 15 minutes. So we'll try to do these briefly within the next 10 minutes, and then we'll have some time for questions as well. So the next one is testimony. So this is a great way to not only present yourself to policymakers as an expert and get face time, but you're bringing your patient stories. You're directly telling these policymakers and your representatives how this legislation is going to impact your patients and how it's going to impact how you practice medicine. There's different types of testimony. There's written testimony and oral testimony, excuse me. And oral testimony, of course, right now with the COVID-19 pandemic may be virtual, and that's okay. So I wanted to give you an example of testimony and where to even start. And I would say the biggest thing with oral testimony is most oral testimony will limit you to 3 minutes. 3 minutes sounds like maybe it's a short amount of time, maybe it's a long time, but you really want to practice multiple times giving oral testimony before you actually deliver it, because I have seen people who are not practiced get cut off, and that ruins your message. So you really want to make sure that you've got everything down pat, you've done your timer, you know how long it's going to be. Also anticipate possible questions. So remember, the people who are making these policies are not the experts, and they may ask you questions and you should be prepared to answer them. It's also okay to say, I need to look into that and get back to you. You never want to make something up on the fly. So here's the anatomy of testimony. This is true for both written and oral. You always want to address who you're talking to, specifically the chair or chairs of the committee, using the appropriate title, typically honorable, things like that. What are you there? Well, who are you and who do you represent? So you're an OB-GYN, you work at this hospital. And what are you asking them to do? You're asking them to support this legislation, to not support this legislation. And the rest of your testimony is really talking about, why is this important? Why are you even here to testify? Why are you even taking the time to write written testimony or provide oral testimony? So again, you want to go through describing in lay terms. You want to be very careful. Even words like hemorrhage, preeclampsia, those are not terms that the general public use on a day-to-day basis like we do. Avoiding acronyms is also really important. So have someone who's not in medicine read over your testimony, because you want to make sure that it's making sense and that the people listening to your testimony aren't getting caught up in these complicated medical terms. So instead of hemorrhage, excessive blood loss, things like that. I would say the biggest component is to tell those patient stories. The statistics are important. We use them all the time in medicine when we're talking about it to each other, but really the patient stories are going to resonate far more with policymakers than the statistics. And I know sometimes that can be frustrating because statistics can be powerful, but they want to hear that patient that you took care of who will be directly impacted by this legislation or has been impacted by prior legislation. You want to use HIPAA compliant, of course, not giving any patient identifiers. And sometimes I'll tell, if there's a patient story that is borderline, they could be identified, you can tell a version of that story so that it's still HIPAA compliant, but it gets the message across. At the end of the testimony, making sure you're coming back to what your ask is, you're reiterating why it's so important, and you're driving home that point of, why this should be passed or not passed. You can definitely address some of those opposing issues and opposing viewpoints, but don't spend a lot of time on it. Don't give that a lot of airtime. You're there to advocate for or against this legislation for a specific reason. Again, you're bringing it home at the end, making sure that you have a kind of solid closing statement and keeping it under that 3-minute mark. So for this sort of testimony, for written or oral testimony, the exercise is really thinking about what's happening in your area, where that legislation is in the process. Oftentimes these bills are in committee, and that's when those hearings happen. If you have a lobbyist in your state, they'll know when the hearings happen. If you don't, you can always reach out to your representative to ask, I'm really interested in this legislation. I would like to testify for or against it. Can I submit written testimony? Draft and outline. We also in the Google Drive have provided do's and don'ts for testimony that are included in there that you can use. And again, use your resources. Reach out to APGO, State Med Society, especially the State Affairs Office. And this is, again, just the general guideline for people for giving this testimony and outline. So hopefully that's helpful.
Great. And I will also just make a plug that this is a great way to engage medical students and residents and learners, because having that trainee perspective is something that legislators often will be also intrigued and interested in, and sometimes maybe less harsh as far as their commentary goes. But it's also an amazing way to get involved as a learner and to utilize your learners around you with their expertise as well. Um, are there any other questions for that portion? I'm going to share our last worksheet here. Get to it. A little bit of toggling here. All right. So lastly, we'll briefly talk about sort of curricular development and your programs. And really this is also meant to be, there's no one formula of how to incorporate teaching advocacy into your environment, but we do know that it is becoming a very, very common ask amongst applicants for both at the medical school level and at the residency level of how is advocacy teaching being incorporated into the curriculum. So we'd really love to hear from folks about what's been working at your institutions or what have you been thinking about doing, and I'll share what we have been doing at Tufts. So, you know, this is was our essential pilot programming of our Tufts Advocacy Program, or TAP, as part of our residency advocacy curriculum that was started 2 years ago. We really wanted to engage residents in structured advocacy opportunities and really impart skill set based modules similar to what we're doing in this workshop that can be applied to different topics of interest wherever residents may find themselves wanting to participate in advocacy. So we had and still have each year 6 didactics modules that are dedicated to these 6 topics that we felt kind of encapsulate different ways of doing advocacy. So we talk about legislative advocacy 101, the ins and outs. We talk about a reproductive justice framework and how to do advocacy through this framework. We talk about communication. So we did a module on written communication as well as communication through social media. We've had speakers come in and talk about using evidence and research in conducting health advocacy work, which was really wonderful. We've talked a little bit about like how to engage in multidisciplinary advocacy, particularly looking at law and medicine, and have had, we actually had some folks from the Harvard Law School give us a talk on Medicaid and provisions and the sort of that overlap again between law and medicine and how it plays out in your clinic. And then we also had a session on tenets of global health advocacy. So you can, you know, create these sort of subject matter or competency or skills-based aspects as you see fit and what would fit well for your residents. There are many other kinds of advocacy opportunities that we've engaged residents in, including journal clubs throughout the year, creating advocacy pods, again, recognizing that sometimes during the year, different folks may have more time or energy to give to these projects than others. And so working together as teams of residents and students with a faculty mentor on different topics has been an effective way that we've been engaging in advocacy this year. Structured writing opportunities. So residents are very fortunate at Tufts to have an opportunity to work with Dr. Evans and all the amazing advocacy work she does. And specifically, we are, during our 2nd year, we participate in writing in an advocacy column that under OB-Gyn management, working on some topic that we're interested in with her guidance. There are many advocacy-based electives that different programs have set up. I encourage you also to create mentor groups based out of advocacy. There are many champions of advocacies, I'm sure, in your departments. And so connecting learners with those faculty members may spur this sort of more structured way of doing advocacy as well. And then as Dr. Evans mentioned in her talk, encouraging folks to participate in these state lobby days, which makes such a huge impact on your institutions and your community and what you can provide and what and developing those relationships over time. And then also other events, things like the Congressional Leadership Conference. I will say kind of doing this advocacy work and in a structured way does not come without its challenges, which can include trying to be creative about figuring out coverage, particularly for residents, and participating in these in-person activities. Again, competing clinical interests, of course, and then sometimes also figuring out ways to get that buy-in from learners and from faculty of really committing to this work. But I think the more and more you do this work, the more it creates a culture of this is part of our wellness. This is a part of how we express our passion, and in a really big way of how we can impact those around us. So the exercise for this aspect is basically, again, just sharing ways that advocacy is incorporated into your clinical training at your institutions, as well as thinking about these champions in your world and your networks, whether it's your institution, whether it's your colleagues, whether it's your people you went to residency with, or folks that you've met at conferences, and thinking about how to connect with these people to make this advocacy work more a team-based approach and more feasible in that way too. So I will stop there, and we only have a few more minutes for questions, and we encourage you guys to participate in these exercises as well. But we're happy to take questions now on any of those topics or general comments of things that you guys may be doing at your institutions as well.
Yeah.
Thank you guys for your presentation. I really appreciated all the topics that you went through. Who runs your advocacy curriculum? Like, who gets the speakers? Is that Dr. Evans, or is it resident run predominantly?
Yeah, I can speak to that. So it is mostly resident driven, in the sense that myself and another co-resident have sort of figured out how it's really nice, because it is a dynamic way to do it. And it kind of, again, depends a little bit on the buy-in each year to year of what the residents are asking for. So that way, if it is a little more resident driven, we can say, okay, this year we're going to get more speakers. This year we're going to change it up a little bit, do these more team-based approach things, and it feeds off of that feedback. I will say it can be challenging to sometimes, when we first rolled this out, we did have 6 different speakers from outside institutions. And frankly, that wasn't the most sustainable model, just because it takes a lot to go into kind of organizing those speakers. And I think also it just wasn't the most fruitful way of really engaging residents and using that time to conduct the advocacy work. So I think we've learned over the past few years of initiating this, that kind of keeping that dynamic format of kind of feeding off of what the residents are asking for is a good way to sort of approach it. That said, we have, excuse me, amazing support from our faculty. I mean, Dr. Evans has given a lot of the talks for our advocacy curriculum, obviously through her expertise. And I think you have one, Dr. Evans, FYI, coming up on social media that's scheduled. So I think it's also a really great way to engage the faculty and their expertise of what they're doing. Another example is faculty that are engaged, that are participating in the maternal morbidity and mortality review committees in your state, inviting them in, different people who we had a couple faculty members from neighboring institutions who also run different clinics in different aspects and helped participate in those talks. So it can be dynamic.
And